Good afternoon, everyone. You're all very welcome to this EAPC webinar this afternoon. We're just going to give a couple of seconds to enable all of the people who registered to join the webinar. So my name is Joanne Brennan. I'm the CEO of the EAPC, and I'm delighted to be on this webinar today with the NursEduPal team as we present this third in the series of webinars. I'm joined by my colleague Guillermo, who is the expert on everything technical in the background, and we're delighted that you're here with us this afternoon. The webinar is going to start very soon. We're just going to make sure we give everybody a chance to come in and join us. So for your information, once the presenter starts presenting the slides, you can change the size of the slides and you can use translation. If you go to the settings, the three dots at the bottom of the screen, you can use those settings there to help make the slides more accessible for you. The webinar is being recorded, and the recording will be available on the NursEduPal IMPACT website within the next 2 weeks. As an attendee, you're not on video and we can't hear you, but you can engage with the speakers by using the chat function. So what we'd like you to do now is see if you found the chat box and tell us where in the world you're joining us from today. There is a certificate of attendance for anyone who joins the live webinar, and towards the end of the webinar, I'll post a link in the chat box where you can click on a page and download your certificate. You'll get access the evaluation form, and then you'll be able to get your certificate. So all that remains for me now to say is that I hope you enjoy the webinar. I'm now going to hand over to Danny Variki, who is the one of the leads on the NursEduPal IMPACT team, and Danny's going to chair this webinar. Thanks, Danny.
Thank you, Joanne. Good afternoon, everyone, and a warm welcome to all of you joining us for this third session in the NursEduPal IMPACT teaching webinar series. In this second series of webinars, we turn our focus to themes that are important for those aiming to grow as clinical leaders in palliative care. Our goal is that by the end of the series, you'll feel more confident and equipped in your approach to providing palliative care. I am Danny Verreke. I am the coordinator of the NursEduPal IMPACT project and research coordinator together with my colleague Veerle at the School of Nursing of West University of Applied Sciences in Bruges, and that's in Belgium. Before we get started, just as a brief reminder. The content we share in our webinar series is designed with the generalist healthcare provider in mind. That means it's accessible and relevant for a broad range of professionals working in various care settings. So it's not specialist level. As Joanne mentioned, the recordings of all sessions, along with the presentation slides, will be made available on our project website in the project resource page. We're also preparing e-learning modules and syllabi based on the same themes and content, which will be offered in English, Romanian, Finnish, and Flemish. In addition, we're developing practical impact tools to help you grow your confidence in applying what you learn. These too will be accessible in 4 languages. All of this is part of our commitment to support you on your path toward becoming a more influential voice in palliative care, a real palliative care influencer. Now I have the pleasure to introducing today's speaker, Christine de Bossere. Christine is a nurse and a senior lecturer and coordinator in palliative care at Artevelde University of Applied Sciences and Artevelde Academy in Ghent, also in Belgium. I met Christine in 2021, I think, when I reached out to the palliative care lecturers of all universities of applied sciences in Flanders to unite ourselves into a learning network aiming to improve palliative care education for nurses. This proved not to be an easy task, but Christine joined enthusiastically and we've kept in touch and supporting each other's activities ever since. With more than 2 decades of experience in end-of-life care, Christine brings a wealth of expertise in education, program coordination, and international teaching and training. Christine, we're very glad to have you with us. The floor is yours.
Thank you, Dani. Thank you for presenting me. So I will share now the presentation. So I hope this is okay. So you can see the presentation, I
Yes,
hope?
we can see the presentation, Christine.
Okay. So, hello, everyone. Today we will talk about advanced care planning. So this is the topic for today. So I'm Christine de Boscher from Artevelde University of Applied Science, Ghent. This is in East Flanders. So Dani and Veerle and Heidi are from the West Flanders. I'm from East Flanders. So I will start the presentation with a small story about myself and my mother. So you can see here my mother who died, who passed away, I think 10 years ago. And the other photo, that's me. So why do I start with this? Well, because my mother had COPD, so chronic obstructive pulmonary disease, and I have it also. So, but my mother, she really suffered a lot. She didn't want to talk about dying and about her values, about her wishes. My father, he did for himself, but my mother never wanted to talk about. She said always, you are the nurse, so you will do what is the best for me. So that was a very difficult task for me. So, but I have seen her different times suffering a lot. She was also a lot of times hospitalized with pneumonia. When I was a child, she couldn't take care of us. So it was, very hard, the COPD of my mother. So for me, the treatments are better than in that period. So for me, it's okay. But of course, here in Belgium, we call about palliative patient from the moment that somebody is diagnosed with an curable illness. So I am a very little bit palliative, but I'm still okay, so don't worry. But for me, it's very important, and I'm very happy that we have a good system of palliative care and about advanced care planning here in Belgium. Because for me, quality of life is really very important. In my opinion, my mother's end of life was really not in a good quality of life. So for me, advanced care planning is very important. So I talked about, and I planned already my values, my wishes, my preferences for when I'm older and when my illness will become worse, and especially for the moment that I cannot express my preferences by myself. So I have 5 children. I asked them to come and visit me once for a meal, and then I presented them my advance directives. So they were really looking very strange because they hadn't respected that. But and I could also see the importance of doing this because 5 children, they are all 5 different. Their values, their ideas are not always the same like mine. So it was a very important meeting that evening. So that's a bit the topic from today, but I shared you first my personal story about this. If somebody has questions, of course, you can ask it in the chat. So now what we will talking about today, what is advanced care planning? When do you start it? When do you need it? How can you do it? Why is it so important? And who can do it? So that's a bit what we will talk about and learn about today. So what is it? The definition, there is, of course, a clear definition about. Advanced care planning is defined as the ability to enable individuals to define goals and preferences for current and future medical treatment or not medical treatment and care, to discuss these goals and preferences with family and healthcare providers, to record these preferences in an advance directive, and to review these preferences when appropriate. So that means that it's an ongoing communication process. So the first step, of course, is thinking about what is quality of life meaning for you. So it's very individual. So the first step is thinking and communicating about personal values, life goals, and preferences regarding current and future medical care. So that can be very early already, at any age and at any health status. But in Belgium, we see that people don't like to talk about dying and about end of life and about suffering and about illnesses. They keep it a bit in their own environment, or even not. They keep it for themselves. They don't talk about it. So it's a bit a taboo. And I think there are a lot of other countries where there is the same taboo. I work with a lot of countries in my international program that happened already 18 times in our school, the interdisciplinary program on palliative and end-of-life care, where we invite students and teachers from a lot of countries from Europe and also out of Europe, and we see a lot that it is for a lot of students and teachers very difficult to talk about those topics. So because of that, there are some tools. You can use tools to open the communication about these topics. What I just wanted to ask is the people here now in the webinar, are you teachers or are you healthcare providers? So it would be nice for me to know if there are teachers or what are your professions here in the group. So you can put it in the chat if you want. So then I can have an idea how to talk about those tools. So I see Sabine is a teacher, palliative care nurse from Pakistan, teacher, clinician, nurses, nurse educator. So I can see it's a nice mix of professions. But the tools that I will talk about, yeah, Andreas also about, so yeah. So the tools that I will talk about, you can use it in different ways. You can use it as a nurse professional, just like Patricia now wrote in the chat, but also as a teacher. So I will explain a bit. So maybe you know the Go Wish cards. It's you can find it. It's organized. It's oh, my English.
Developed.
So, it's developed. Yes, thank you, Danny. It's developed by Coda. And you can find it on the website, the Go Wish cards. But in Belgium, they did a big research about the ideas from the Belgian inhabitants about palliative care and end-of-life care. And as a result of the research, they created our own life wishes cards. So those are cards where you can find on each card one of the values or preference that people can have when you become in your end of life. So I don't know if you can read it very well on the presentation, but I can put it on the slide in a bigger paper. So I will share it in the slide. Then I can share here something, but I don't see that I can share. Danny, is it possible that I cannot share a document in the
chat?
Yeah.
Normally, you should be able to do that, I think. We haven't tried that yet, Christine. You are the first.
I don't see. It's not possible. Maybe we can yeah, provide it later then. So I have, of course, this paper that you can see now here and on the screen in a bigger format, also in the Word. So if you like to use it in your own language, you can translate it because I can provide it for you in a Word version. So you can translate it in every language. So those things are important things for people when they become in the end of their life or when they become very ill. Can you read it or not?
It's a bit small.
It's a bit small, yes.
But maybe if people enhance the size of the slides, maybe it's easier.
Yeah. So, but in the slides, it will also not be easier. So I will just read some examples of it. So to be able to share my memories and achievements with others is one of the things. Having a doctor who knows me well as a person is also one of the cards. Not dying alone. Something else, dying at home. Having a spiritual guide for support. To keep my dignity. Don't be a burden to my family. Trust my doctor. That my family is prepared for my death. Keeping my sense of humor. Being surrounded by good friends. Have no pain. That I can pray. So all those things are things that Belgian people told in the research, research that it is very important for them. So now for the teachers, I will explain how I use it when I teach my students in a big aula, for example. So they can see it on the screen and they can, so I ask them to look at the paper and to think for themselves, because I think it's really very important to think for yourself as a caregiver what is important for you, and that when you become in that stage, because when you never thought about it for yourself, it's very difficult to talk about this with clients, with patients, with residents. So I let my students think about this, and they have to choose the five most important things of those cards. So I give them some time to do this. So if you can read it, you can do it also for yourself now, but I don't think I think it's too little to do it now. So I ask the students to write down the five most important things for them. The next part of the exercise for students is to give their paper to their neighbor. And then I ask to everyone to line through two of those things from the other. So do you understand? I hope you understand me. So they have to line through two from the five things that their neighbor found very important for him or herself. And then I ask to give it back to the owner. And then the exercise is to try to feel what it means for you when you see that your wishes, your preferences will not be fulfilled. So it's really a kind of simulation feeling exercise. So it's very good exercise for students, is my experience. So, and then after that, we do debriefing about this, and we ask then, how they felt by looking and feeling that their wishes will not be fulfilled. What do you think, how you should feel in that case? You can put it in the chat. What kind of emotions do you think there will be? I hope everyone understood my exercise. Yes, to be angry and disappointed, of course. Yeah, that's an emotion that is very common. It's not fair, yes. Disrespected, yes. Okay, so loss, yeah. So I can see in the chat that most of you could understand my exercise. So we do then after that debriefing with students, and then the next part of the debriefing is also how do you feel as a caregiver when you have to line through the things from the other, because that gives you the same feeling like you are not able to fulfill the wishes, the preferences from your client or your patient or your resident. What do you think that means for a caregiver, for a nurse, for a doctor, for, yeah. Helpless, okay, yes. It's hard to do, you don't want to do it, so yeah. So yeah, I think caregivers become very stressed, and it's a kind of painful stress because it's a moral stress. Not respecting wishes, coming short, yes, so you cannot do what you wanted to do and what was very important for your client, the feeling of not worthy, yeah. So you can see how important it is to know what are the preferences and the wishes from each person so that you can fulfill it in the end. And it's good for the patient, client, resident, but it's of course also very important for the caregiver, because otherwise you become all the time in a state of stress, a state of moral distress. So that's not good to not it's important not to have that kind of situations a lot, because otherwise you will become maybe in a kind of burnout. So this is a very good exercise. So I give Danny or Veerle, I give you the word version of this cards so you can translate it, and you can also do this exercise with students. But also for the caregivers, it's good to work with those cards, because you can just talk with your patients, your residents, your clients about topics. You can let them choose, you can let them think, you can let them talk. So it's much easier to talk about those things when you use a tool. And this is a very good tool, I think. Is it okay for everyone? I hope everyone could understand it. Okay, I see some duimpjes. Duimpjes, yeah. Danny, I don't know, duim.
Thumbs.
Eh?
Thumbs up.
Okay, yes, good. So, but advanced care planning is much more, of course, than a one-off contact where an advanced directive is written. It is a continuum focusing on quality of life. So it's as a result of the advancing illness, priorities may change, of course. So it's always possible to change your advanced directive. That's also very important. It's not because you wrote something down 1 year ago that it is still now what you want. So long that you are able to talk and think and connect with people, you can change your mind, your preferences, so you can change your advanced directive. So whereas good quality of life and not being dependent may be priorities when thinking about ACP and a healthy status, living as long as possible might become priority number one when diagnosed with a life-threatening disease. As the illness progresses, preferences may still change to, for example, being comfortable or being surrounded by close ones. So it can change. So for myself, I don't know very well. My children, they say, "Oh, mom, you will change your mind." So now I said in my advanced directives, If I will become dependent from oxygen, then I want to stop my life. I want to stop my treatments because I don't want to be dependent from oxygen. So that's my opinion now. But maybe when it will be so far, maybe I will just be happy that I can still live with oxygen. So I don't know yet, but it's important to think about and to change my mind if I will be able to change my mind, if I will still have the capacity to make decisions. Because until the moment that I can tell it by myself, it will happen what I want at that moment. So here you can see a framework. This you can also find in the syllabus. It's a clear framework that you can also see in different periods of your life. So in the first period, maybe you can make your advanced directives when you are still healthy. Then when you become serious ill, then maybe you can change. And then, of course, really in the end of life, maybe you change again. So it's a continuum of, it's a dynamic process. In module 1, you learned about the palliative care indicators. The signs that indicate the need for palliative care were explained. So you can see on the poster, you learned it in module 1. But of course, the same signs are also indicators for the need of advanced care planning. So every time that there is a critical moment, it's important to take again a look to the advanced directive, and maybe there is a need to make changes. So here you have the poster. You can also find it in the syllabus with all the ACP indicators and also some extra ACP plus indicators. So this you can find in the syllabus and also here in the presentation. But I will not read it now. So why is it so important? Of course, because of the benefits, because only then you really can give patient-centered care. It increases also the autonomy and dignity. In our system here in Belgium, autonomy is very important. I know in some countries this is not that much important because also the family can have a big role in some countries to make the decisions. So what is another benefit? It prevents unwanted hospitalizations and investigations. So because in an advanced directive, you can write which kind of investigations, which kind of hospitalizations you don't want anymore, and also when you don't want it anymore. So, for example, when you will not be able, when you are unconsciousness, for example, because of you become in a state of a first state of dementia, that you don't want to be hospitalized, for example, or you don't want to go to intensive care, or you don't want dialysis, and so on. So it prevents unwanted hospitalizations. It will also decrease moral distress of the healthcare providers. So this is what I tried also to let you feel with the exercise that we did with the life wish cards. So decreasing moral distress of healthcare providers is also a very important benefit, because in Belgium we really have a lack of nurses and healthcare providers. So we have to take care for them also. So it's working with advanced directives has also an effect on the good feeling of the healthcare providers. And it will reduce health-related costs without increasing mortality. So, a timely and well-conducted ACP process has benefits for patients, their close ones, their healthcare professionals, and healthcare systems. So here you can see also very important for the close ones. So like I said, for myself, I have 5 children. I don't want when I become in a state of unconsciousness and they have to decide something, I don't want that they will have conflicts about this together. Because when they would not be sure what I wanted, what are my preferences, maybe they will have big conflicts, and I don't want that. So it's very important also for the close ones of the person who makes his advance directives. So for who can make it? Of course, the patient, and the best case, it's in connection with the relatives. So not bringing up the topic does not mean that patients and their close ones do not want to talk about it. So it's not a lot that it happens that people ask it by themselves. So there is really a big duty for the healthcare providers. They have the duty to be alert to changing care needs with all their patients, especially those with a serious diagnosis, and should be able to explain the importance of advanced care planning. So Veerle was talking already about the self-efficacy of the caregiver. Also here, for making advanced care planning, this is a very important competence of the caregiver, to be able to explain the importance and to try to communicate with patient, client, or resident about those topics. So I have also another tool that is very nice to use. I always use those cards also when I plan an advanced care planning meeting with clients. So this is an extra tip that I can give you to improve literacy about suffering and dying. Also with students, I really like to use those cards. It are also cards, but it's a bit different than the Life Wish cards. They are coming from the Netherlands, but also this tool, I translated it in English, and I also made it in a Word version for you. So you also can translate it in your own language if you want. So I will provide this too. So these are cards, and the name is choose and share. So you can choose cards, and then you can share and talk about the things that you can read on the cards. So you can do it in a group, or you can do it individual, in one by one meeting. I just think it is also too little to read, so I will try to read some of those texts to give you an idea what is in it. So you have to, you see the two parts of the cards, and then you have to choose what is the most for you. For example, on the one side, you can read, when I'm ill, I wish to do as much as possible myself. And the other side is, I wish as much assistance as possible in order. So, and with this kind of cards, you really can have an idea how is your client or patient looking to care and to become dependent. Another example is when I'm ill, I prefer my relatives to take care of me, or I prefer to be taken care of by professionals. Another one, for example, I want to decide myself when I die. Of course, that's not always possible, not in every country possible. On the other side, like my mother also said, nature or fate will decide when I die, and God will come and take me when the time is ready. So then some other types of questions are, for example, I would like to talk about my fears and worries with a professional, and then the question is, do you agree or do you disagree? So as you can feel, those cards really create space to discuss different things, to know your patient better about those topics. For example, I would do anything to prolong my life. And the other side of the card is no, thank you. At some point, I will think enough is enough. So if you think enough is enough, then maybe you can stop treatment. So it's right for the patient to stop a treatment. So, but maybe a person also can have the idea, I will do every treatment that there is possible. So I would like to do anything to prolong my life, even when the side effects of the treatments are very bad. Another very short sentence on the card is, that scares me. Do you agree or do you disagree? So it opens the communication about the feelings about dying. So it's very important that people can tell you why they are afraid. Is it for the pain? Is it for their children, or what is it about? So it opens communication about all those topics. Yeah, another one, for example, I can very well be on my own. The other part of the card is, I like people around me. Also, this is something very important. Some people, they really don't. We think that it's very sad to die alone, but I remember some patients who really said, I don't want my family is with me when I will die, because I don't want them that they see that. So it's very important also to talk about things like this. So with these cards, you really can open the discussion and the communication about all those things. So I hope this is clear how to use it. So also this you can use with patients, but also with students. So I really try to learn my students to talk about topics like this, because sometimes when I visit them in the internships, they said, oh, my communication is very good with my patients. But when I listen, then what are you talking about? It's mostly not going deeper than, oh, the weather is fine today, and Belgium won the football, and so on. So they really have to learn to talk with patients on spiritual level and emotional level. So with these cards, they really can learn this and exercise with this. So who has a role in ACP? It's not solely the task of trained facilitators. Of course, it's good to have them, but all healthcare providers in all care settings have a role to play in advanced care planning. So while some healthcare providers are trained to actively conduct ACP conversations, all healthcare providers, they really should recognize the signs of patients or their close ones, that the care plan needs to be re-evaluated or adjusted. They have to refer those patients to the healthcare providers, such as the family doctor, the home care nurse, the palliative care referent, who can conduct the ACP conversation. They have to be able to give correct basic information about advanced care planning. So it's really something that every healthcare provider needs to be able to do. So, and very important is to recognize misconceptions of patients or their close ones about this topic. But of course, it's very important to have the capacity to make decisions. A person is considered to have decision-making capacity when they are capable of making informed decisions about their healthcare or other important matters. So they have to understand information, they have to weigh the consequences of their choices. They have to make choices based on their own values and preferences, and they have to be able to communicate about that decision. So verbally, but also in writing or otherwise. But it can be possible that people are incapable of decision making. What is this? This is when they have lack of capacity and they cannot understand, assess, weigh, or communicate decisions, either temporarily or permanently. So, for example, people with dementia, delirium, brain injury, mental illness, unconsciousness, intellectual disability. So in that case, it's really very important that they have a legal representative who will make decisions on their behalf in line with their known wishes and best interests. So also this is something really very important to do the moment that you are still healthy and that you are conscious. For example, I have 5 children, but I wrote down that my youngest girl may be my legal representative the moment that I cannot tell it anymore by myself. Not my oldest son, because he is very good in organizing events and festivals, but not in the, I think he is not good in organizing the care that I want for myself. So I think it's really very important that you write down who may be your legal representative the moment that you still are able to do this. So this is the kind of framework, the 4 abilities model to assess capacity. So yeah, I thought it's a kind of summary. So important understanding, appreciation, reasoning, and expressing choice. So, but of course, it's not black and white. So it's not black and white. Some people, they can be able to make decisions for some things, but for other things, maybe not. So it's not black and white. So how can you do it now to write it down? Your advanced directives, your living will. An advance directive or living will is a legal document in which a person clearly outlines their preferences for future medical care and what care they do or do not want in case they become unable to communicate or make decisions. So this is very important. So those advance directives only apply when the patients lose or lack decision-making capacity. So that's very important. So how? In Belgium we have our documents from the Federation of Palliative Care, from Palliative Care Flanders. We have this here, also from another organization. So I think, it depends from country to country which papers you can use for this. There is a 3-part structure in it: life extension, functioning, and comfort. So made through a process of shared decision-making involving the patient or with the legal representative and the healthcare team. So a collaborative decision is based on the patient's current medical condition and prognosis, the patient's values, goals, and preferences, the benefits and burdens of possible treatments, and the expected impact on quality of life. I see a question. Do you have a proxy in your country? What is a proxy? Donnie, do you know what is a proxy?
I think it's a vertrouwenspersoon.
Oh, yes, that's the next slide. It will come. De wettelijke vertegenwoordiger, this is the legal representative, yes. But you also have then Yeah, the vertrouwenspersoon. Yeah, it's for the next one of the next slides. I think, but here, I will go to the. Oh yeah, this is here. Okay, this is the answer of the question. So we have legal representatives or substitute decision makers, and we also have the patient advocate. So when the patient is no more possible to make decisions by himself, then the legal representative is the very important person. And then we also can have a patient advocate. This is also chosen by the patients, but that person has no formal decision-making power. So that's more for the period that people are still able to talk by themselves, their preferences and their wishes. Is this an answer, Andreas, for your question? Okay, yes. So I go back to the other slide. So we in most of the countries, they work with DNR codes. So it's a bit, yeah, DNR, do not resuscitate. It's a code that is known in most countries, I think. So the DNR code is a therapy restriction code to avoid aggressive resuscitation that may not improve quality of life, especially in advanced illness or at the end of life. In many parts of Europe, a DNR code is a clinical and ethical judgment made by the doctor. Nevertheless, patient involvement is expected, and the doctor is ethically and often legally bound to consult and inform the patient and or his close ones. So that's about the DNR code. So this I said already. I see the end is near from the presentation, and it's already 14 hours, 47 minutes. So I just want to clear out also the terms palliative care and terminal care, because I don't know if this was yet in the modules already. So palliative care, just like I said for myself, it starts when you are diagnosed with a life-limiting illness, regardless of the life expectancy. The focus of palliative care is on quality of life and maximum comfort. But then the terminal care is just a very, very little part of palliative care, because that's just the end, so the last days or maximum the last week. So the terminal phase is also accompanied by typical symptoms. Terminal care is not a synonym for palliative care, but a lot of people, they have some misconceptions about this. So terminal care is just the care in the last days, and you will learn more about this part of the palliative care. So the terminal care in module 5. And then just some explanation about palliative sedation, because also there are a lot of misconceptions about. So palliative sedation is the medical act of intentionally lowering the consciousness of a terminal patient, so only a terminal patient, so in the last days of life, with the aim of relieving suffering which could not be adequately relieved by any other means. So we call it refractory symptoms. So palliative sedation, the goal of palliative sedation is pain and symptom control, not to shorten the life. But I think you will learn more about this in other parts of the project. So here you see a framework with 5 myths, of hoe zei je dat? Myths about advanced care planning.
Myths.
Myths about advanced care planning. So you can also find it in the syllabus, but I think that you now all can talk about this myths in a good way. So I also give you some work at home, so you can test your knowledge about this webinar, because in the syllabus you can find even more misconceptions about ACP, advanced care planning, and also the answers. So you can do your personal test at home. And of course, also very important to take a look at the impact tools for advanced care planning that are provided by the project. So I will thank you for your attention. If you have still questions, of course, you can ask. There is still a bit of time. Yes, we do ensure palliative sedation of terminally ill patients. Yes, yes. I think in most countries they know and they use the palliative sedation. Here is a question: how can we ensure that when a patient changes to another setting, that all ACP information is also transferred in case there is no shared electronic patient record? Yeah. Patrick, this question is from you. This is really a big problem also still in Belgium. So it's very important to motivate people to take their advance directives with them, and also the legal representative, that he can give the documents to the next place where the patient will go. We are working here also on an electronic platform where all those information can be possible and be able for all settings, but this is also still a problem here in Belgium. So yeah, it's a bit the responsibility of the legal representative and also the patient by himself when he is still conscious to take it. But also in the home for elderly, we see that they have documents that they always, when the patient has to go from the home for elderly to a hospital for some reason, that they have specific papers with all the advanced care directives on the papers. So they always give it to the next stay, to the next place where the patient will go. Patrick, I hope this is an answer, but it is still a problem also here. We know that the term terminal care is not used in all countries. In several countries, it is referred to as end-of-life care. It is the literal translation of terminal care. Yeah, this is okay, Dana.
Yes, I put that there, Christine, because even within our team, we are still kind of sometimes fighting with terminology. That in some countries we use terminal care, and then in other countries this has a very negative connotation, so they prefer not to use it. So yeah, we are kind of still in debate what we are using for terminal care, but most probably it will be end-of-life care. But I saw somebody wrote they call it end-of-life care pathways for terminally ill patients.
Yes. We in Belgium we also have pathways for terminal care. Yeah. Okay, so I am finished, I think. Shall I stop?
Yes, you can stop sharing. And if there are no more questions from the public, I think we can pass the word back on to Joanne to end the meeting.
Okay, thank you very much. Thank you to the NursEduPal IMPACT team. For arranging the webinar. Thank you for Christine for a brilliant presentation. I thought it was really, really interesting. And thank you to Guillermo for looking after our technical support in the background. I'm going to share the list of the upcoming webinars. As you know, this is part of a series. And we would urge you now to go and register for the upcoming webinars as part of this series. And there will be one later in 2025, I believe, is looking at self-efficacy. I think, yeah, okay. So keep an eye. I've put 2 links in the chat there on where you can get more information about the project and where you can find out more information about the series of webinars. So please do go on there and register for those. And then the last thing that everyone I know is waiting for is, where do you get your certificate from? So that's here. If you click on this, or click that link there, that QR code, it will bring you to the page where you can fill out an evaluation form and then download your certificate. You download it as a PDF and then you fill out your own name, print and fill out your own name. Okay, so thank you very much to all of the team. Thank you to Christine. Thank you, Guillermo. I'm going to leave that slide up now so participants can get the link to get the evaluation and the certificate. Well, thank you again. It's a pleasure to have such a committed team helping us in the APC to advance education and awareness around palliative care. This is a really, really important topic for us.